Hi, you've reached Dr. Carina Lopez with Vitalist Healing Traditions. And today we're going to be talking about iridology. Iridology is one of the most beautiful and helpful tools that you can glean. Iridology is not a therapeutic tool. It's actually an assessment tool. It's the tool we use to find out and discover what's happening to you by looking at a picture of your iris. It's non-invasive, so it's not like getting a colonoscopy where, God forbid, you can get something like perforation in the intestine and end up in the surgery ward and in the hospital for weeks. This is a tool that you can use way before any issues even appear to understand how you can prevent any potential issues and save yourself any grief. It's a wonderful tool, and it could be used for acute and chronic cases. So it's a way to find out what's really going on. So let's start. So what is iridology and how can it help me? That's what we want to know. So iridology is the study of health via an examination of the color, structure of the iris, sclera, and pupil. Iridology is a form of alternative assessment. Remember, we're not doing any therapeutics. It is only to understand what's going on in your body. On a basic level, iridology allows us to understand potential strengths or weaknesses in organs and tissues. With this information, we can begin the natural healing process using prevention, using safe therapeutic tools like food, herbs, homeopathy, and more. At a complex level, iridology shows you so much. And here at Vitalist Healing Traditions, we use classical iridology, constitutional iridology, emotional mapping, time risk, and ancestral iridology. And you'll come to find out through this interview that your eyes really are the windows to your soul. Little bit of history of iridology. Ancient sources quote Hippocrates and other ancient healers from around the globe using forms of iridology for their patients. Our modern understanding, though, is said to come from Ignaz von Pexley, who is considered the father of iridology. Now, I'll tell you the mythology of surrounding him. Essentially, he was a little boy. He went out to catch an owl. And in his endeavor to catch this owl, he broke the owl's leg. And when he caught it and looked at the owl, he noticed that there was a defect that grew on the owl's eye. And he said, wait a minute, you didn't have that before I caught you. And now suddenly you have that. Perhaps there's an interlink between the body and the map of your iris. And an owl's eye is so big and beautiful. So it's easy to see that. Now, from the owl to today, since Pexley, there have been other prominent researchers in the field, including Pastor Emanuel Fleck, Rudolf Schnabel, Joseph Deck, Joseph Angerer, Henry Lindlar, Dr. Hazel Kritzer, Dorothy Hall, Bernard Jensen, and Tony Miller, my very own teacher, and much more, of course. So how does iridology work? The iris is the most complex external structure in the human body. It has a reflex connection to every organ and tissue by way of the nervous system. Through the optic nerves, which are attached to the eyes, visual information is sent to the brain, and at the same time, everything is sent back to the body so that you can change what you need to change in terms of your organs or tissues. So we know that, as an example, if we see a lion charging at us, we know that our heart rate's going to pump. We know that we are going to sweat and we are going to run. And so your body and your eyes are interconnected. But when there is an issue with your body, There can also be a blunting in some of the nerves that reach the iris. There could be darkening, there could be lightening, there can be all sorts of signs, and even in the arteries around the sclera. And what they're finding is that it's not only the nerves, but also our capillary system can open up, can close, can dilate further based on what's going on in our body. And this empowers us, this empowers us to say, wait a minute, something's happening, and we can do something right before it becomes a real issue. And that's the beauty. So now let's go into the art of iridology. Some structures of your iris you're born with. You inherit them, meaning you inherit all of the ancestral issues in your life, beautiful or complicated. So it's not only that you get things based on injuries or something going wrong. You actually have an imprint, a map that you're born with, telling you how to move forward in a healthy, healing fashion. All right? Now, the eyes aren't just the sum of one little feature. The art is that we're looking at many different features and how they interlace and how we can help the person with that very knowledge. So we'll piece through all of the cues to identify how we can help you. Remember, every eye is different. In fact, it's used as an identification tool for biometrics. In some airports, it's required that you show your iris because it is different for every individual. So it really is a unique footprint. Now, going into the different types of iridology, I'd like to start with classical iridology. In classical iridology, just to give you the sum, you're looking at a chart, all right? And here's the iris map. There's many different iris maps. And there are corresponding organs depending on where in the map you're looking at. So right here at 6 o'clock, we're looking at the kidney, adrenal areas, the femurs. So there's different aspects that we look at depending on the defect, and we always look at the map because that is our stepping stone to understanding where the problem could be. Now, iridology not only is looking at prevention, but it can actually detect really serious issues. One of those issues is a corneal arcus. Now, the age of obtaining a corneal arcus is really the telling tale of how severe of an issue it is. Now, it's an age-related condition. It creates a deposit of cholesterol and phospholipids and triglycerides on the top, bottom, and sides of the entire surrounding iris. So here's an example. You see that white, bluish circle around the eye? Well, that's suggestive of elevated serum, cholesterol, triglycerides, blood pressure, atherosclerosis, cardiovascular degeneration, a tendency for liver dysfunction, disturbed fat metabolism. And it's much more significant if it's seen in somebody between the ages of 30 and 40. So if you see someone in your family, someone you love, with that and they're 30 years old, you've got to send them out for blood work. It is urgent. In fact, this very marker in modern classical allopathic medicine is considered what we call corneal arcus juvenilis if it's in a person younger than 40. And it really is attributed to, I'll repeat, fatty liver, atherosclerosis, coronary artery disease. So if you see this, time to act now. And if you're older in age, I would still act. I would still say, you know what? Let's do some healthy prevention. And let's begin working on our liver, our cholesterol, and our cardiovascular system, our arteries, our veins, etc. Now, the next is constitutional iridology. There are 6 different structures that we know of and 11 different diatheses. I'm going to explain 2 different structures and 1 diathesis in our conversation today. The anxiety tetanic, the connective tissue structure, and the lymphatic hypoplastic diathesis. Here, let's just do some background. The black part here is your pupil. Right surrounding here is your collarette, which actually has to do with your digestive system more than anything. And the limbus is where your organs come out and where we can understand the workings and health of your organs. Now, to understand what an anxiety tetanic eye would look like, you would have circular contraction furrows, which are these lines circulating the iris, radial furrows, which are longitudinal lines going up and down, and an unstructured collarette, which is going down and around, but not in a complete circle. Next, we see the connective tissue structure. That's an unstructured fiber pattern. The lacunae and defects are throughout the whole iris, okay? And then we have lymphatic hypoplastic diatheses, which are where you have lymphatic runners, which if you can see this color and this very thick white line going through, as well as a discolored humoral zone and tophi with pigmentation. So you can see all of the different colors around, and you can see these little, what we call lymphatic tophi, which are these little clouds. And that's essentially telling you that that person's lymphatic system is a little blocked, okay? And they've accumulated these little clouds. And it's a really good opportunity to say, hey, you've got to cleanse your lymphatics. So let's see what we can do for these types of eyes if we see them in people. Now, for an anxiety tetanic structure, usually these people will have a type A personality. They could be irritable. They could be prone to colitis, palpitations, blood sugar issues, and even burnout. So these people need to really get in touch with the life lesson of there's always tomorrow, okay? Some potential deficiencies are magnesium and calcium phosphate. Next, we have the connective tissue structure. This can affect the bowel, the glands, and the nerve supply. There's a tendency to reduce tissue support. So these people are more flabby and more big and perhaps even more tired, all right? And so they have reduced metabolic function. They're colder, they gain weight easily. And they also tend to be really gregarious and happy and work well with others. Some deficiencies would be silica, all right? Magnesium, calcium, vitamin E. Next is the lymphatic hypoplastic diathesis. This could contribute to chronic inflammation in the mucous membranes, potential fluid retention, and edema. There's difficult excretion of waste, which we touched upon with the lymphatics, all right? And so these people have to make sure that they're pooping. They have to make sure that their lymphs are really kind of moving and doing some lymph brushing, taking in some herbs that will really help move that lymph. Drinking water is very important. And, letting things go. Because when you hold things, that also shows emotionally that perhaps you're not letting things go. So some deficiencies could be vitamin C, E, A, zinc, and making sure they have lots of antioxidants and some healthy laxatives like chia seed, for example. Another aspect of looking at the iris is emotional mapping. Now, just to let you know, this isn't an old concept. In Chinese medicine, every organ has a corresponding emotion. An example would be the liver holding lots of anger. So in iridology, we have the same. But when we're looking at my perspective at Vitalist Healing Traditions, we're using many tools. So iridology is an aspect that really will help us to understand the emotional mapping, but also bearing the intelligence of ancient systems also will help with understanding iridology even better. So here you have escapism, anger, will, self-reliance, all coming out when you're looking at the left eye from this behavioral iridology map. So many ways to look at the iris. Now, even deeper, you can go into chakras, elements, complex emotions, life goals. I mean, really, it's a beautiful way to understand yourself at a soul level. And we can help you do that. Now, time risk is a very interesting concept in iridology. Essentially, looking at the collarette, anything that intercepts the collarette is related to a year. So this is age 0, and this would be age 30. Okay. And so looking at the time is very, very interesting. Now, you may say, wait, are you telling me that if I have a dent in my iris, let's say at around, the age 2, 3, 4, something like that, that potentially something could happen to my child at the age of 2? There is a potential for a good or a bad thing. But the idea is to think of the corresponding organ and how we can nourish the organ itself to prevent any issues. Because, like the Chinese say, even good news is bad news. An example would be a wedding. That's something that could appear in your iris, something that's going to greatly change your life. But it's a beautiful thing. But still, you want to take care to relax, calm down, and make sure you ensure the healing of your body. Is time risk association only in iridology? No. There's ancient Chinese systems where you look at the palm of the hand, and that you can also look at time risk, where the ancient clinicians would look at times on someone's hand and say, hey, you've got to be a little more careful with your liver at the age of 30. And so these are ancient concepts that are important in understanding your healing, your potentials, and how you can use prevention as your favorite and best tool. Lastly, I would like to present a case and talk about ancestral iridology. So you're born with certain markings on your eye. And these markings indicate potential childhood as well as trauma that has surfaced again and again and again in your past generations. And so identifying that and working with it is a beautiful thing because I believe it will help change your future. And I believe that there is an aspect of you that has come here to make that change to help future generations. Now, looking at this case, this is a woman that came to see me, and this is her eye. And we look here and we see this very big, what we call a giant lacuna. This giant lacuna is connected to the breast, the lungs, and if you look, it's indenting the collarette and right at the heart place. This person was traumatized by her mother and felt a sense of abandonment from her mother. And it's on the left eye, which is associated with the mother. Okay. In a discussion, this person really felt that abandonment was key in her life. And there was a lot of anger and sadness around the mom. This person was also a sufferer of asthma, as well as having constant palpitations with stress, especially if she felt that someone had potentially abandoned her. This person also grew up with lots and lots of ear infections. If you see this lacuna is right by the ear, and was also verbally abused. So a lot of the work that we did was dealing with those feelings of abandonment for this person, helping this person breathe better, accept a lot of what transpired between her and her mother, forgive, love, and just begin a renewal of a relationship with healthy boundaries and acceptance of who she was. And you really see in this picture of this specific person how beautiful and elegantly the changes in physiology, where she was no longer using an asthma pump. She was no longer taking anxiety medication for palpitations, but instead was facing the issues as well as working with homeopathy and therapeutic tools like herbalism, spagyria, food, and so much more. This didn't happen in a day, but I'll tell you something. It was a sure sign to make a difference, and I do believe that this person has created the tools for their tribe, their generations in the future to continue healing and creating a beautiful, healthy role in their life. And that's what iridology can bring you, an awareness and a path to healing, not only yourself, but for the future generations ahead. And I love this painting here. This is the Sistine Madonna by Raphael, because you see the baby Jesus, and he's in a upright position looking forward in a beautiful enveloped anatomical heart by the Madonna, being ushered in by Pope Sixtus and Saint Barbara, and just going into the world and incarnating into the world with a knowledge. And so, this is a Christian drawing, but there are many mythologies throughout the world, even in Judaism, where you have a baby in the womb and an angel comes and tells the baby its life. And then suddenly, when the baby's ready to come out, the baby is flipped and everything is forgotten, but the intuition remains. So I hope that this is something that you can use as a stepping stone to glean further the path you have to success, meeting your health goals, and helping with the future of your family line. Now, there's 3 pillars for a successful visit. One is trust. We really want to glean your trust and to show you how we're honored to speak to you, be present with your story, and help you unravel the mystery of your eye to help guide you. We encourage openness so that we can help piece together the puzzle and help you with your life. And of course, action, because iridology is the assessment tool, but it's not the therapeutic. And so once we learn, it's time for some therapies, and that we'll talk about later, because we have some beautiful alternative healing, safe therapies. And what matters? Teamwork. We're going to work as a team. We're going to talk together, and we're going to unravel all things. Your collaboration with us, listening to your goals, meeting you where you are, that's all so important for us, as well as the leadership of you taking it on and saying, you're going to do this and make that different. And we know that you're capable of making that difference. And thank you so, so much for listening, for being present. And we really are excited to see you soon. And we hope to be a part of this glorious journey to make our world a better place. Have a wonderful day. And this is Dr. Lopez from Vitalist Healing Traditions.